to change, how science and kindness help people change. And Dr. Kosanke is a licensed clinical psychologist with 20 years of experience. As the Director of Family Services at CMC New York, she works in the clinical practice of treating substance use disorders. She also co-authored the award-winning book, Beyond Addiction: How Science and Kindness Help People Change, and has been interviewed on radio programs and podcasts. Her writing has been featured in Huffington Post, Counselor Magazine, and Oprah Magazine. Dr. Kosanke also serves as a consulting psychologist and trainer for CMC FFC, which is a nonprofit organization providing evidence-based skills training to family members who have a loved one struggling with substance use issues. She is a member of the Association for Behavioral and Cognitive Therapies and the American Association of Addiction Psychiatrists. And so with that, I'm going to turn it over to Dr. Kosanke and welcome her. Thank you so much for being here today.
Thanks so much, Karen. I'm really glad to be here. Welcome, everybody. Thanks for taking your lunch hour with me today. Feel free to eat whilst we talk about these issues. I'm going to go ahead and get started by sharing some slides with you. And as Karen said, we're going to do our best to make time at the end for questions. Okay. Are we good? Okay. Okay, so let's get started. So the main tools that we'll be talking about today are applicable to substance use issues, and I think all of you don't need a reminder probably for the devastating problem that substance use and the related impact on relationships, on functioning, on the healthcare system, et cetera, have in our society right now, not to mention overdose risks. And unfortunately, there's a very real problem with disseminating information about what's really helpful and what tools can be helpful to family members that are struggling and scared. And there's a lot of shame that gets in the way of really answering those kinds of questions. So I don't need to explain to you what kind of a problem this is, which is why we have the Foundation for Change, which is specifically designed to create a sense of community for families with clear evidence-based strategies to really change the conversation that we're having in our society about substance use problems, and directing it more towards conversations of engagement, of staying in relationship with people when it's healthy to do so, and with compassion as opposed to punishment, shame, and isolation. So that's our mission at the Foundation for Change, and what was the impetus for us pulling together a variety of different strategies from different therapeutic modules to really create the Invitation to Change approach. So this is the main idea around the Invitation to Change approach, which is creating a climate in which growth can take place. So nobody can control other human beings. You can only have an influence. And as parents in particular, we do have an influence as parents to really create a climate. You know, there are different aspects of that we'll be talking about today, but this is the main idea right here. So this is a helping model that is accessible to parents, to other family members, to loved ones, and also to professionals. So I do trainings for professionals as well as lay people, coaches, et cetera. And it's the same kinds of tools are applicable for all those different groups of people. And these are the three main therapeutic approaches that the Invitation to Change is drawn from: community reinforcement and family training, the motivational interviewing, and acceptance and commitment therapy. So you may or may not know anything about those. You don't have to, but if you wanted to look them up and hear more about the different pieces of where the science comes from in this approach, you can do so there. So this is the whole Invitation to Change in a nutshell. All these different little circles represent different areas within the model. So we are looking at primarily today as an example, because I literally can spend days talking about this, and sometimes do. So the larger trainings is several days of full day trainings, or many weeks of chunks of hours. So we're not going to be able to go over the details of all of this. So we're going to dig in a little bit towards the helping with understanding section of the approach, which is that blue section there with the behaviors make sense, one size. Excuse me. Wow. I don't think I'm alone with the allergies today. One size doesn't fit all, etc. So ambivalence is normal is those three blue circles are, we're going to go into more details, but I do like to show this whole wheel so you have a sense of like the entirety of the model. And if you choose to do more training with this approach, you'll learn some of these other pieces as well. So this is the section we're going to talk about today. So when we talk about this concept of behaviors make sense, what we mean is that even destructive behavior, even behavior that looks absolutely nuts from the outside, is motivated by reinforcement. So we label what motivates someone and what makes it worth it for them to repeat behaviors. We call that reinforcement. So when we're talking about how to address the problem of substance use, we're really looking at what reinforces that behavior, what makes sense about that behavior for the individual doing it. Because you're going to find something. It makes sense in some way for them to repeat it. It may not make sense at all times and in all ways, and there may be huge consequences in addition to what makes sense for them to do it. But finding this nugget of meaning and the way in which behaviors make sense is critical to really being effective as a parent or a family member from the outside, because it allows you several different opportunities for helping. So if I told you that I had something that would help you do all of these different things, I think most of us would be signing on, right? Feeling less depressed, check. Feel good, get rid of boredom, make me the funniest person in the room, decrease my anxiety. All those things sound pretty good, I think, to most human beings. And these are also the reasons that people use substances. These are the motivating factors. So when we try and think about this from this lens of behaviors make sense, that concept, it's really helping us have empathy as a human being. These things that are motivating someone to use substances are really, the motivation itself is pretty understandable, pretty human, pretty normal, pretty relatable. Everybody wants to socialize well, everybody wants to be funny and not anxious and not depressed, etc. These are understandable, nothing wrong or morally abhorrent about these desires. And this is really the core of what helps a loved one feel empathy and connection to someone who might be using for these reasons. So when we're looking at someone's behavior, it is very tempting to only look at the crazy, nutty, horrible sides of it, because those are the things that are most important to us on the outside. That's what we see happening. But the thirst is really the reason that someone would continue to do something that otherwise seems nonsensical or dangerous. So as I said, this idea of behavior makes sense really helps us to not take the behavior as personally. It helps us have more empathy. If you have more empathy, you're more likely to move towards someone instead of stepping away and trying to protect yourself from them. And if you move towards someone, you're more likely able to collaborate with them. It's sort of a positive cycle that can be created when there's an approach rather than an avoid stance. The other thing about this is that it helps in really identifying a pattern and some sense that's to be made from this behavior that can often feel like really scary, random, erratic, etc. But if you boil it down to like, what is the reason that makes sense for them around doing these things, then it can feel more predictable. And that, most human beings feel less anxious when there is predictability, when there's less randomness and unexpected things happening. And the thing that I focus the most on, I was going to say it's most important, but all of these things are really important. At the end of the day, you want, as a family member, the reason you're here most likely is to figure out what you can do differently. How can you help? What can you do? What's under your control to influence somebody who is doing these things? And that is a piece of what Behaviors Make Sense adds, is it allows you to better strategize. How is it that I can have an impact? In particular, around supporting behaviors that compete with those rewards. So if people are using substances to decrease anxiety, what are some activities that you could encourage and support that would provide that same kind of reward, that same anxiety reducing reward, like mindfulness, like relaxation activities, like a soothing environment, like taking a walk, exercise, therapy, anxiety reduction techniques, like variety of different ideas come to mind immediately when you think about it in that way. When you think about, I'm looking at the specific reward that my loved one is getting from this substance. So, and the understanding piece also helps our loved one to feel more validated as a whole human being. Because if I'm only relating to my loved one as a person who drinks or a person who uses substances, then they feel very restricted in who they are. And I see them as a very restricted human, not as a whole human being. And if my loved one feels more seen as a human being in the entirety, then they're more likely to share with me things that otherwise might seem unacceptable. So if I'm telling them, this is the only thing I want to hear from you, then all those other things that they might be thinking or feeling or doing become unacceptable. And then I don't hear about those things and I can do nothing about it. I cannot brainstorm, I cannot collaborate, nothing unless I hear about it. So considering change is something we'll talk more about with communication, but that there are particular ways in which people are more open to considering change and being able to hear that other people are recognizing that there might be benefits to their behavior can have our loved one feel less defensive about needing to defend that reason. So we'll talk some more about that. Oh, I am not, there we go. A path is a prior interpretation of the best way to traverse a landscape. So what we mean by that is that there are many ways to traverse a landscape. And a path is created and makes us think that that's the best way, and the only way maybe. But in fact, there are many, many different ways to traverse a landscape, just as there are many, many ways to get in and out of substance use difficulties. People use for many different reasons, and different strategies work for different people. So this idea that there is only one way to get better from substances, I think we're getting our society is getting further away from that, thankfully. But it used to be like rehab or death. And that way of thinking really makes people terrified, right? Because if they have very understandable reasons, not being able to afford rehab, not being able to leave their family for a whole month, not all pretty reasonable reasons that might be perceived as denial, but also might be actual reasons in the world, then that puts them into a stuck place that they either have to do the thing that you're suggesting, or they're considered to be in denial. So what we know from the evidence is that different strategies work for different people, and people are much more likely to follow through and sustain a plan if their individual circumstances are validated, recognized, and worked with. So that is a critical piece to remember as you are talking with your loved one, to speak the language they're speaking and be able to really take their individual circumstances into consideration when talking to them about treatment, or about, what the obstacles might be in their mind for taking some action of change. How does this help us to think about the way that, one size does not fit all? Well, it provides hope in knowing that there's different ways to help. Families don't have to do just one thing. They can choose a path that aligns with their values and what they know about their loved ones. So a lot of times families will talk to me about trying to get their loved one into treatment, and they'll say, well, I know him, he's not going to say yes to that. So then we can work with okay, so you know him a lot better than I do. Let's brainstorm what is going to be more likely to be working for him, for your family. It also increases the flexibility in how families can be of help. So they don't have to just be wed to one path. There can be options and choices. People are much more likely to be collaborative, and you're much more likely to have buy-in if you really think about things from that perspective of individual differences matter and your individual circumstances matter, and here are some choices, as opposed to one way or the highway, which people can understandably be defensive about. So I think most people can relate to this. Our dilemma is that we hate change and love it at the same time. What we really want is for things to remain the same but get better. So this applies to a lot of different circumstances, but the way that we embrace or hide from change is a pretty human trait. And it's understandable when people get scared about making big changes. So this third idea of ambivalence being normal part of change is the third section of the understanding section, in terms of having helping with understanding section. So in terms of this idea of making a big change, we have this notion with substance use that you have to be all in. You have to be single-minded. You have to have determination, and any sign of ambivalence is a sign that maybe you lied before, or you're no longer resolved, etc. That may be the case, but in almost every major change that human beings make, we expect there to be some ambivalence. People do not get hit by lightning and suddenly make changes wholesale. It is extremely unusual. that happens occasionally, and we usually make a big movie about it, make lots of money, and then people feel bad if their life doesn't go that way because it seems like it's so easy for other people. But the fact is that anyone who's made a big change in their life knows that they felt pretty mixed about it. On the one hand, I want to do this. On the other hand, I don't. On the one hand, I want to make this choice. On the other hand, I want to make this other choice. The thing about ambivalence and being normal is that new behaviors can compete with the old behaviors, but they don't erase them. So if I have a new habit of walking in the morning, that can build up and I can get momentum and I can start to feel the rewards of that. But it doesn't erase the fact that I know I could also sleep in and it feels pretty good. That memory, that habit of sleeping in, it doesn't go anywhere. That's still a pathway in my head. I know it exists. I know the benefits of it. So it's not going anywhere. Same thing with substance use changes. There is a way in which your brain remembers very clearly for physiological, anatomical reasons, how good it feels to use a substance, how much anxiety reduction you get. Of course, there are downsides to all those things, but that memory, that reward, that pathway in your brain doesn't get erased. So you can see a person's ambivalence in their behavior, in their language. And the thing about communication is that it can be quite sensitive to the responses of people around them. So if people around someone who's ambivalent say, well, we just got to confront this denial, these are the reasons why you need to make this change. If we're focused on like getting them to back into a corner, talking some sense into them, then what do we think might happen? I mean, it happens with people making changes with substance use, but it also happens with any other change that you might be making, which is that, people go underground. They start to defend. Well, what do you mean? Like, you're not thinking about this other piece that I am drawn to, which is this back and forth. There are reasons to change, reasons not to change. And it really is not a sign of failure. And it's in fact to be expected. So how does this help us to think about ambivalence as a normal part of behavior change? Again, it increases our empathy as family members and increases a sense of like connection to, yeah, I understand ambivalence is a normal part of me making that change or this change, so you can kind of relate better. And it helps reframe your experience of seeing and hearing reasons for not making change as being stuck, as only being stuck or in denial. So there are tons of different communication strategies that are very specific around this point to help family members learn strategies for responding to ambivalence when you see it, so that you do not inadvertently get your loved one to defend the other side of their ambivalence. So if I say, the reason why you should do this is this, that, and the other thing, they are going to quite naturally bring up the other side of their ambivalence, which is, well, there's quite a few reasons why I shouldn't do that too. And you're not mentioning that. So that's an interaction. That's a dynamic between me and my loved one. I can have an influence over that. So those communication strategies are all about decreasing defensiveness. Okay, so we're going to zoom through this other section, this peach section of helping with awareness, which includes self-awareness, willingness, and self-compassion. So as your awareness increases, so does your control over your own self. So the more you know about your own well-being, the better able you will be to manage those feelings that come up, the better you will be able to brainstorm solutions. So really being able to honestly, in DBT language, which is a therapeutic approach, we call this radical acceptance. I must radically accept that I am having these thoughts, that I'm having these feelings, that my body is exhausted or tense, that I'm having these reactions. The more that I notice and increase my awareness of that, then therein lies the possibility for change, right? Then I can do something about it. But a lot of times what people feel about awareness is like, why should I be more aware of the fact that I feel shitty, or I feel like horrible, or I feel despondent? Like that, how is that going to help me? That's our sort of normal cultural approach to awareness, unfortunately. And what that means is that you're going to end up feeling like you don't want to be in touch with your feelings, and there's no good reason to do so. But in fact, this is a hard process. Loving someone who has a problem like substance use disorder is really tricky. It's confusing, it's complicated, and the approach that you have will have an impact on how you experience it. If you are in a sort of an avoidant, shut down relationship with your stress or your emotions, then you're not going to notice when the gas tank is running low. And not noticing when the gas tank is running low will have a big impact on whether or not you have a really explosive conversation or you have a calm and collaborative conversation with your loved one. So that's sort of an easy example, but there are many, many other examples of really running low on your internal resources, not being aware of it, and then you end up by the side of the road in the middle of nowhere. That metaphor, I think, is quite apt for these kinds of problems when a family member is dealing with this amount of stress. It's incredibly painful, difficult. There's a lot of different feelings that come up. If you don't acknowledge them and manage those feelings, then they are going to be a detriment to you. They're going to stand in your way. They're going to make it harder for you to connect with your loved one, not to mention connecting to yourself. So what matters to you, there are a lot of different, I'm kind of whizzing through these things, but just know that there's a lot of different ways to learn more about these concepts. And what matters to you as a person, as well as in your relationship with your loved one, has a big impact on your ability to sustain this process, sustain the relationship, sustain learning a new way of talking to your loved one, a new way of managing these problems. And if you stay grounded in what your values are, you're much more likely to be able to overcome those obstacles and manage your stress in a more healthy way. So really taking it seriously that you are a variable in this equation that matters. I think a lot of helpers sort of see themselves as outside of the problem and like, I'll deal with my stuff like after they're better, like I'm fine. Like I can't tell you how many parents I've spoken to that say this to me, like, listen, I know how to go to the spa. Like, let's just get my kid into treatment. I'm not talking about just going to the spa. I'm talking about staying connected to what matters to you and how your body, your emotions, your mind is really metabolizing this experience so that you can brainstorm how it is that you can respond and you can be strategic instead of reactive. Having an awareness around your emotions really allows you to make choices about what you're doing. And that's quite empowering feeling, rather than feeling like you're constantly on the back burner, like, reacting to things, not planning ahead, etc. You feel like very frazzled. So having a greater sense of your own well-being and making choices can allow you to do some things that really feel much more empowering and allow you to sort of bend instead of breaking is the idea. So that yes, you experience the same wins, but you have a different relationship with it. So this idea of willingness is that we really embrace what matters most to us about our relationship with our loved one and what's uncomfortable about it. So they make me angry, they hurt my feelings, but the relationship matters to me. Commitment matters to me. Being a good parent matters to me. Being a person that I can respect when I'm, 100. My grandmother just turned 101, so I'm shooting for 100. So when I'm 100, like, I want to look back at this life and say, like, I was a compassionate person. I showed up for this person in the ways that I want to be. And that includes limits. It includes communicating clearly. It includes being a good role model and how I'm taking care of myself, etc. It's not just about like being a nice person. It's like the whole enchilada, right? And the relationship includes these hard things too. So when the things get hard, I can remember what matters to me about sticking it out and doing these things that matter the most. So these are the kinds of things that people usually say when we ask this question of like, what matters most to you about your relationship and what's uncomfortable. So things like hopefulness, being connected, loving, respectful, etc. And there's this other side. Now, if we think about these as two separate things, obviously we would choose to walk away with only one of those circles. But in fact, this is more like a coin. This is more like one thing. One is on one side, one is on the other. And when you think of it as a coin, then you remember, okay, so yes, I'm experiencing this discomfort, but this matters a lot to me to show up in a way that I can respect and value. So that is the side of the coin that I'm going to look at. Am I going to pick it up or am I going to put it down? So a relationship comes with the risk that these things may be uncomfortable. And do you stick it out? Do you take a break so that you can stick it out? Like, it's not a simple matter of like just staying in the relationship. It's about taking care of yourself as well. So how does this idea of willingness help us? It helps us stay connected with your loved one when it's painful, because the relationship matters to you. And working on being flexible and managing these kinds of things in this way is challenging. And dealing with uncertainty is challenging. And being honest with yourself about this challenge, that it's not no big deal. It is really a challenge and needs to be a choice that you are accepting, as opposed to fighting off the hard stuff and trying to invite the positive stuff. So there's a lot more to be said about this, sort of a deep concept actually, to really intentionally invite in and have a deeper awareness of what your values are as a person. But it can be very helpful in sort of stabilizing us when things are harder. So this other idea of self-compassion, self-awareness, I do want to just direct people to Krista Neff. If you don't already know her, she's written quite a few things, a lot of research-based information about this idea of self-compassion. So in our culture, you can find like self-help books all over the place. Self-care is a sort of a buzzword lately. And so I want to get away from like the buzzword aspect and really relate to the compassion piece, which is a deeper, more values-based notion, which is not just about the things that I do. Do I, take a bath? Do I, have my hair done? Do I allow myself to like eat something that is healthy and that I enjoy? Those are activities that could be self-care and could demonstrate self-compassion. But the compassion part is really about knowing that I need some relaxation, some rest, some caring, that I need this, and then attending to it, however I do. So really attending to that deeper level of awareness that helps you be more compassionate with yourself. So Kristen Neff has these 3 Ps: be patient with yourself, be part of a larger community, and being present. And when you focus on these 3 Ps, you can have more awareness of the ways that you might not be quite as compassionate with yourself as you have a tendency of being with other people. You might give other people a more breadth of excuses or whatnot than you give yourself. But focusing on these 3 things can really help you have compassion for yourself. If you compare yourself to the larger community, human community, for instance, if you identify as a human being, then you can see, and I see this all the time with parent groups, is nobody wants to go to a parent group, don't want to be a member of the group of people that are dealing with these issues, because you don't want to believe that this is really happening to you. So everybody will resist being in a group. A lot of people do, not everybody. But when they do, I'm always so saddened, because when I see people in groups, what I see is how much validation they get hearing from other people going through something similar. Mistakes happen, people suffer, hardship is experienced, and that experience of hearing other people going through something similar really lifts that weight of isolation in a very visceral kind of way. And some of you may have had that experience to really know how much weight is lifted when you feel like, okay, I'm not alone in this. This isn't like my singular, mistake or character flaw that's landed me in this situation. I am human like other people are. So these are 3 different strategies to sort of orient your mind towards self-compassion and managing your feelings in a healthier way. Why does this help? It helps you find deeper values, even when you're in pain. And you can even share this process with your loved one. More collaboration, the better. We do want this internal voice of kindness, which can translate also to the voice that you have with other people, including your loved one. Staying present as opposed to going into the past. And that's a big one, because you can be really stuck in the past when there are substance use issues. Why can't it be like it was before, etc. And that takes you away from being able to really manage the situation in the present moment. So our last section is helping with action. And we have these 2 aspects, which is communication and behavior response. And what we want to start with, there's a lot more to be said about communication and the specifics of how you say things and when, etc. But the first piece to just know is that words really do matter. They have a big impact, whether you use this word or that word. It can have a big impact on how people hear it, whether they hear it, whether they shut down to you, whether they open up. It can really be helpful to focus on communication in families with substance use, because there's often a lot of heat in the relationship, a lot of anger, hurt feelings. People don't understand each other. They're feeling frustrated, unheard, etc. So in that situation, it can really be helpful to shift ambivalence. It opens doors of communication. You can better encourage positive behaviors, which compete with the substance using behaviors, if you're able to talk about it in an effective way. As opposed to negative communication, such as confrontation, shouting, etc., labeling, name calling, all of that generally closes doors of communication and shuts down the possibility of being able to make progress and being able to discuss collaboratively how to move forward. It changes the tone of interactions in the home. It reduces conflict, and it helps your loved one's voice of change get stronger. And that's that ambivalence dynamic thing that I was talking about before. Really having this collaborative approach helps your loved one to feel a part of the process rather than being spoken to, being invited in, and have less charged topics be able to be discussed in a more positive way. Because you know how this works, like you're angry about this thing. It's not like suddenly you can turn on a dime and go like, oh, how about the weather? Or like, oh, that was really nice what you did with your sister. Very hard to do that if you're really upset about this other thing. So it can really help to work on communication in several areas of your life. It increases the likelihood of being validated and really listened to, and creating that positive cycle. So here are some examples of these communication strategies. What we like to say is that we're interested in really inviting and supporting change that focus on seeing those red lights of communication. That's when your loved one is saying like, no, don't want to talk, not interested in change, like giving you all those verbal and nonverbal cues. Those are red lights, right? So what we're interested in with these strategies is changing those red lights to be green. So some of the examples are listening collaboratively with listening strategies. So listening is a very active role, actually. There are a lot of things you can do to demonstrate that you're listening and you're taking the person seriously. Some of them have to do with nonverbal and body language, how you're presenting, eye contact, all that. And some of the others have to do with what you say. When someone says something, what do you say in response? What kinds of questions do you ask? Are you affirming them? Are you reflecting back that you've heard what they're saying? Are you helping them to summarize what, so that you make sure that you've gotten it right? Another strategy, so ORS is from motivational interviewing, open-ended questions, affirmations, reflections, and summarizing. Those are all from motivational interviewing. If you've done any lectures about that, you will recognize those. Offering an information sandwich can be really helpful. If you have some specific information that you want to share with someone, that's a really helpful way of, can't just all be about listening, right? Sometimes you have to share something, you have to make a suggestion, you have to give some feedback. When you have to do that, the information sandwich is a really helpful tool for that. And then there's this idea of surfing, which is a way of identifying the specific strategies of communication to help you be more collaborative. Again, I'm not going into all of those details today, but when we talk about behavior, that's the communication piece. And then there is the, how do you respond differently? So just as a reminder, when we're talking about reinforcement, we're saying, okay, so a behavior is likely to be repeated if it's reinforced. And if it's not reinforced, then it's more likely to stop or decrease. So that's our main idea underneath the idea of positive reinforcement. So these are our main strategies around responding. How can we positively reinforce those new shoots, those little seedlings growing up just slightly and becoming plants? How do we support, protect them from the wind, flowers that need water, all of that stuff? How do we support those new behaviors? Because it is very easy to trample new behaviors when they first get started. We want to develop a habit. And developing a habit means that those new behaviors, like doing something differently instead of using drugs, that they get supported and reinforced. When we're talking about how do we limit or reduce substances, what impact do we have? Well, we can look at consequences. How do we allow for natural consequences? Get out of the way so that natural consequences can occur. Don't protect someone from having an experience, a non-lethal consequence, that is. get out of the way and have those consequences impact them. And then there are limit setting, rolling out logical consequences. That communication has a lot of role in doing that effectively, because you want to do a very intentional job around how those consequences are applied, communicating about it in advance, etc. And then the last strategy around limiting is to step away. So this idea of making sure that you're not inadvertently reinforcing a negative behavior just with your presence. So stepping away can be a good strategy. So reinforcement requires noticing a behavior that you like and rewarding it. It's not just being nice randomly. It's specific to a particular behavior. If you are able to get home on time, I'd love to have dinner with you. If you don't make it, then we'll take a rain check, because, I'm going to be eating at this time. So that's an example of I'm reinforcing the on-time behavior. I am not going to be present for the behavior I'm not trying to reinforce. So it increases the likelihood that behavior will happen again, maybe even increase. It's really central to this whole idea of positive reinforcement. So this idea of positive opposites is really what I've been talking about all along, which is that new behaviors that compete with the rewards of substance use. So if I mindfully attend to a yoga class as opposed to smoking pot, that is a new behavior, a positive opposite that competes with a substance use behavior. And that can be reinforced by my loved ones if they come with me, if they pay for the yoga class, if they encourage it, if they ask me about it. There's lots of ways you can reinforce a positive opposite behavior. And this is really key. Like, does a person believe that there is a way to live without substances that is rewarding? It may sound silly, but people lose faith that that's the case, and that it's possible. So some expert tips: be clear to yourself and communicate to your loved one what's the behavior you want to increase, how are you going to reinforce it or reward it. Remember to make sure that you are giving a reward after the behavior, not before. So I'll give you, your allowance at the beginning of the week if you promise me you're going to do all this stuff this week. No. The reward comes after I see the positive behaviors. Otherwise, you end up feeling burned. They're most effective when consistent, timely, matched appropriately. You're not giving like the biggest reward you can think of. You're not throwing a party for tiny things. You're really trying to be consistent and appropriate to the behavior. And remember that reinforcers are in the eye of the beholder. So it has to make sense to them, not just to you. What might be appealing to me may not be appealing to my 16-year-old. Shocker. How you reinforce needs to also be doable for you. If this is really putting you out to a large degree, then that's a consequence to you, and that is not what we're after. Sometimes it's necessary, but we want to try to manage things that are really doable and reasonable for you to be doing. So these reduction strategies also need to be part of the discussion, but really a combination of these responses is the most powerful thing you can do. Combination of positively rewarding the positive stuff and setting limits and allowing natural consequences, stepping away for the negative stuff. That all together is the most impactful thing that we can do. I think I said a lot of this. Setting limits is not just being tough. It's one piece of a larger picture. It means staying connected, reinforcing positive behaviors, setting clear limits, communicating clearly. And really, the biggest obstacle, I think, is identifying what are those positive opposites? What are the behaviors that you want to strengthen? And get into the details of how to make those things easier. The last concept that we have is about practice. Change really comes by addition, not subtraction. So you really have to practice these things in order for new habits to evolve. They are complex. They can feel awkward at first, and most people don't feel good about how they're doing in the beginning. That's normal, to be expected. So practicing over time with patience for yourself is really critical for yourself and in knowing about your loved one. Okay. There we go. So I hope that was helpful in giving you the full range of the different strategies involved in the invitation to change approach. This was really a drive-by, I have to say, and hopefully some important and helpful strategies came through to you despite that. But I welcome questions, feedback, always interested to hear how people hear this information and what stands out.
Well, first of all, I want to thank you again, Dr. Kosanke. That was a great introduction with a lot of fabulous, helpful tools and information for anyone that could be useful in these situations. I did want to mention that if anyone is interested in learning more about the ITC model, or even potentially facilitating ITC groups in New Hampshire in the future, SOS Recovery Center is offering an ITC training, as well as some potential scholarship opportunities for this training. And their next one starts on May 12th. The contact for that is going to be John Burns, and I will put his email in the chat. And with that, we did have a couple of advanced questions that I want to go to first. And for the rest of you, you're welcome to put your additional questions in the chat. But the first one is, how can one best improve self-discipline to resist temptation?
So that's a very big question. It's a great question. I have a couple of books that I would recommend on this topic. That's how big of a topic it is that people have written entire books about it that immediately come to mind for me. One is the Marshmallow Test, Mastering Self-Control. If you haven't read that book or know about that experiment, it's super fascinating and really interesting. A lot of great strategies there. So I recommend that book. And then the other is a book called Power of Habit. In that book, the thing that stands out most, having read it many years ago, is that you really want to try and remove the obstacles that make it hard for you to be consistent or follow through or be persistent about an activity. And that's really what we're talking about with discipline, is like, how do you maintain persistence, right? So identifying the obstacles and smoothing them over, making things easy for you to follow through. The example I remember from that book is like, okay, if you want to jog in the morning, you're getting yourself having a hard time getting yourself to do it. The first thing you do when you get out of bed is put your running shoes on, like right away. You're just increasing the odds that you actually feel like jogging, right? Like that right away, you're in motion. And I think that's a good symbol for removing obstacles and making things a little bit easier for yourself, like getting in the groove of what's going to make it easier. Because then once you have a habit, then it's easier to sustain it. But I think all of those references could be useful. Uh-oh, I can't hear you.
Sorry about that. The next question is a two-part question. So I'll read part one. How do you define success? Is abstinence the goal or harm reduction?
That's a great question. The thing about the CRAFT approach, community reinforcement and family training, and the invitation to change and motivational interviewing, all of these strategies are really looking at specific behaviors and how to respond to them. So it's not looking at the entirety of a human being and deciding like this person and needs to do this forever and all time. It's looking at a specific behavior and how do we respond to it. So in short, I would say that harm reduction is a great strategy on the way to what sometimes needs to be the goal, which is abstinence. Not always, but for many people, it does need to be the goal. And you have a much more likely chance of getting to that goal if you use a harm reduction approach in the beginning. Not necessarily that everyone who has substance use needs to take a harm reduction approach, but as a family member, if you orient yourself in a harm reduction approach, you're much more likely to have things to work with and to be able to see positive change rather than wait until abstinence is achieved and then you feel like something positive has happened. Because a lot of changes, like I said, most changes don't happen like a strike of lightning. So there are changes along the way that can be reinforced and increase the likelihood we get to that goal if that's your goal in the end. Does that answer the question?
Oh, it definitely did. And I'm sure we could have a much longer conversation about all of this.
Indeed.
However, the second part of the question was, are 12-step organizations missing the point by encouraging abstinence?
So, I mean, I think this is a big debate, right? Is like, what is the best approach? And I would say that different things work for different people. That's just a fact. And for some people, going to 12-step meetings has saved their life. It's obviously a self-sustaining group that's been going on for decades. Something is going right there. People feel benefited by that. Does it help all people? No. Does it harm some people? Yes. So there are lots of ways to get better in this world. And I think that we don't need to start making decisions about one way or the highway at this point. Like, there are a lot of different ways to go about this.
That's a great thought. And one final question that I'm seeing is, in terms of your support groups, the family support groups, and I heard you reference a few times in the discussion about, if you're a parent and the child and so forth, I would say, and I just want to hear your concurrence, that these support groups are also appropriate for anyone who might have a husband or a wife or a partner that is struggling. It's not just a family in terms of parents and children. Is that correct?
Yes, that's right. I mean, the majority of people that come to the groups that, like, for instance, the Family Monday groups through the foundation that I am often the one running, that the majority of people that come are parents, but I specifically added in some Family Mondays that were targeting the concerns of partners and peers, because I wanted to be able to give voice to those concerns, since the majority does tend to be parents, but it's absolutely helpful for all different roles that people have with a loved one.
Wonderful. And then at this point, we're just 2 minutes after noon, but if anyone in the audience has any questions that you want to unmute yourselves and just ask, we welcome those now before we close out.
I think this was fantastic. I really do appreciate your time and your knowledge and how you've brought this to all of us. Thank you so much.
You're welcome. So
Thank you,
glad.
Tanya. So good to see you here. Tanya is with NAMI, New Hampshire. So it's great
Right.
to see you here. Yes. And so with that, Nicole, I believe you've agreed to share the slides. And if you wouldn't mind sending me your contact information and also those 2 books, I can send those out to folks, once we send the follow-up email with the survey, if that's okay with you.
Sure, absolutely.
That'd be great. So again, we are so happy that you were here today. This was such a great presentation, and I'll let everyone go. And thank you so much for